I'm Ryan Dennis, the founder and CEO of Linear Health Sciences. We're an Oklahoma-based medical device company looking to solve the problem of dislodgement of medical tubing from patients. One night, a patient had a chest tube for a collapsed lung, a relatively young lady. She got up to go to the bathroom. When she did, the chest tube got caught in the bed rail of her bed and ripped the chest tube out, causing her lung to collapse again. And I just thought it was ridiculous that we were relying on sutures or tape or other adhesives to hold the very things that are connecting patients to life-sustaining treatment. Instead of applying more and more things to the patient, we said, why don't we use a breakaway valve, just like what you have on a gas pump or on your MacBook. It turned out that Silicon Valley loved it, and the large strategic players in the infusion space loved it. And so we targeted infusion therapy first and ended up finding out that we had taken a commodity and created a new platform technology. What we have here is our flagship product. This is the Orchid SRV. So it's the Orchid Safety Release Valve, and this is meant exclusively for infusion situations. So in this particular situation, you can see the patient's medication is hanging on the IV pole, and then they'll usually have 10 feet of tubing here. This is the part that will get caught in bed rails or that the patient will reach up and grab, because this area here is always covered. It's taped down and covered on the patient. So a lot of our confused patients will reach for anything that's nearby and in the middle of the night just rip these things out. So what we did is we said, okay, if this part's going to be taped down, it's not great, but if that serves as some degree of an anchor, then what can we do where no matter how hard you pull, it's not going to matter. We created this breakaway valve. It seals off this way, so there's no blood getting back out into the system. Nurses aren't being exposed to all the blood you would have in a normal dislodgement. And then whenever this side seals off, the pump will alarm and let the nurse know that they need to come in. And now when they come in, all they've got to do is replace one valve and they're back in business, instead of re-sticking the patient or potentially having to do a more invasive procedure to get vascular access. We designed it where it can't be put back together, actually, because of infection risks. The last thing we want to do is put patients in harm's way. We'll be FDA approved by the end of this year, and we'll be on the market in January of 2017. The startup ecosystem here is more robust than I knew about. I think it's solid. We have a low cost of living. We have relatively low labor costs. We're right in the center of the United States. It's a perfect hub for distribution. I explain all these things to people on both coasts, and ultimately they can never understand how we get so much done for so little overhead. And a lot of it has to do with where we're located. The money was raised right here in Oklahoma, which means the proceeds from our eventual acquisition will also come back into Oklahoma's economy. And since I was born and raised here, that's what I want. Oklahoma is a viable place for startups to set their roots. It's not just viable, it's ideal in a number of ways. We have not a reputation for excellence nationally, but we have the talent pool for excellence locally.